wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. It is going to be a dynamite program. We're going to talk about oral health and dental health and its effect on chronic diseases in America. And I have as my guest Dr. Blanche Grube, who is a biological dentist who's been in practice for over 40 years. And she trained and worked with Dr. Hal Huggins, who was another wonderful biological dentist who really learned from the father of biological dentistry, and that would be Dr. Weston Price. So what Dr. Grube is going to talk about today is material that has been developed over the last 100 years and largely ignored by the dental profession and completely unknown to the medical profession. The reason I want to talk to you about dental health is because farmers and ranchers, when they buy livestock, the first thing they do is they open up the mouth and they look at the oral hygiene and teeth of the livestock they're going to buy. They know that if there's poor dental health, that you've got an animal that's sick or going to be sick, and they don't purchase it. So if they have enough common sense to take a look at the mouth and the oral hygiene, so should we as physicians and, of course, dentists do that. But many of the procedures that dentists perform cause the problems in the mouth that lead to chronic disease. Dr. Grube is a biological dentist, as I mentioned, and she's been in practice 40 years in the Pennsylvania area and also in South Carolina. And she's written a book, Chew But Don't Swallow. And she was a protégé of Dr. Hal Huggins and did some of the really critical work and instrumental work in understanding the cause of systemic disease related to oral health and dental hygiene. So we're going to talk today in this first interview. We're going to talk about gingivitis, that's inflammation of the gums, which leads to periodontitis, which is inflammation of the bone and the base of the teeth, which can lead to tooth loss. And then we're going to talk about mercury amalgams. In a later program, we'll talk about the dangers of root canals and cavitations, and we're going to talk about fluoride. So, Dr. Grube, thank you for joining us today. And tell us first how you met Dr. Huggins and how you got involved with his work.
Well, thank you very much for inviting me. And I have to commend you because what you're doing today in making this information public is a very dangerous thing. So I hope you're always right with God, because you never know when you might be meeting him sooner rather than later, because the powers that be do not want you to do what you're doing, just as they don't want me to do what I'm doing, and they didn't want Hal Huggins to do what he was doing. So I commend you for being so brave and being willing to stick your neck out and tell people the truth, no matter what the cost. So you're to be commended, and I thank God.
Well, it's a privilege, and it's an honor, and it's a responsibility as a physician, and I've come to understand the very important role that dental health and oral health plays in the health of the whole body. I've just got to let people know that, and I've learned about it over the years. But remember, in medical school, we had no courses about dental health and oral hygiene. I think in anatomy class we had to memorize the name of the teeth, and that was about it. So doctors, when they are confronted with an individual who has some kind of chronic disease, never think about how could this be caused by something in the teeth or in the oral cavity. that just doesn't cross their minds. They don't ask about it. And, they'll put a tongue down your throat, look at your tonsils and all that, and just look at your teeth cursorily, but they never put two and two together. Dentists, on the other hand, are trained to keep your teeth looking good. That's what they do. And they do a lot of procedures to do that. They want to keep you looking good and get rid of cavities and those sort of things. But oftentimes the procedures they perform can lead to systemic problems, which they're not taught about. So you've got the dental profession and the medical profession, and they don't really understand how they're connected, how it's connected, and they should be. And that's why I hope this broadcast and this episode today will inform you, listeners, on the very important need for you to be alerted about your oral and dental health. So, Dr. Grube, tell us about when you first met Hal Huggins and how you got involved in biological dentistry.
Okay, well, the year was 1992. A patient had given me an article to read, and she asked me if I would be open-minded enough to read this article. Sure, it was all about mercury and how it affects the body systemically, not just the teeth, but systemically. I read the article. I didn't believe a word of it, not a single word. I thought, no, this can't possibly be. So I took the article to my local medical library, asked them to look up the bibliography and tell me if these were bogus journals or were they real journals. And the nurse calls me up the next day and she says, Dr. Grube, I have your articles for you. I didn't ask for any articles. She said, she says, they were very interesting. I thought you might want to read them. Okay, so I went down to the hospital. I picked up this stack of articles and I began to read. Again, I was amazed. Every article that was written by somebody who had either a PhD or the letters MD after their name. They were all kind of ologists. They were cardiologists, psychologists, every medical profession you could think of. Not a single article written by a dentist, not a one. And yet all of them were talking about mercury and how it affects the body. Well, where do most people get mercury from? Unless they're eating fish every single day of their life, and some people do that, unless they're eating fish every single day of their life, the most common place for people to ingest mercury is from the fillings in their own mouth. So even with all these scientists who were talking about mercury in the body, they were simply talking about mercury in the body. In other words, they weren't saying mercury from fillings. They didn't even make that connection. They were just simply talking about, this is what happens when you put mercury into a creature. This is how long it takes for their kidneys to shut down. This is how long it takes for the mercury to enter into their brain. This is how long it takes for the mercury to cause them to not function anymore. And this is how long it takes them to die. But again, very little mention of where does this mercury come from. I made the connection. I said, wait a minute. The most common place for mercury is in the mouth. Could this possibly be? So looked in the back of the article. It said, if you want more information, contact Dr. Hal Huggins in Colorado Springs. I did. I went out there. Make a very long story short, he asked me, Dr. Huggins, he had a habit of looking at everybody's blood chemistry. If he knew you, he knew you. He knew your blood chemistry. He wanted to see what was going on inside of you. So every dentist that took his course, all 60 of us, had to have blood drawn at the beginning of the class. That blood was sent to Colorado Springs General Hospital. We had to wait 4 days for those results to come back from the hospital. And then he would discuss our blood chemistries with each and every one of us in front of everybody else. So my blood was the first one to go up on the screen. And he said, ooh, we have a sick puppy here. Whose blood is this? And I very gingerly raised my hand. I said, it's mine. He said, "So Blanche, how long have you had cancer?" I said, "Excuse me, where's that? I don't see that here." He said, "Yes." He says, "They circled it in red several times so that you would see it." Hmm. I don't know what metablastic, what is that? He says, "Oh, you don't know much about leukemia, do you?" No, I don't. He says, "Okay, so you have 1% metablastic cells, which is the beginning of chronic metablastic leukemia." I said, "Well, 1% is a low number. That's good." Total optimist. He says, "Well, 1% you're sick, 2% you're in the hospital, and 3% you're dead." The next thing that came out of his mouth totally amazed me because he looked at me straight in the face and he said, "So, Blanche, how many root canals do you have in your head?" Now, this was a course about mercury. We had been discussing mercury and how it affects the body for 3 full days. And some of them were 10-hour days. Mercury, mercury, mercury. And now all of a sudden he's asking me how many root canals I have. I thought, I just met this man. How does he know I have root canals? Hmm. I said, "Well, I have 5." He says, "Good, good, good." He says, "So you're going to get them taken out, right?" No. Why would I do that? I'm a dentist. I have 32 teeth. I'm very proud of the fact that I have 32 teeth, and I plan on going to my grave with 32 teeth. And he looked at me straight in the face and said, "Yes, that is correct. You are going to your grave sooner rather than later." And I thought, have I just been insulted? I'm not really sure. I don't know what's going on here. And he turned around, walked down the steps, and proceeded to talk about the next dentist, whose blood chemistry went up on the wall. And I was left there totally perplexed, didn't know what to do. I certainly didn't want to have any teeth taken out, but I was also very shocked to know that I had the beginnings of leukemia, and I wasn't feeling good. How did he know that? How did he know that? Well, he never had a patient with cancer who did not also have a root canal or a cavitation. Now, for those in your audience that don't know what a cavitation is, we're going to get into that a little bit later and get into it in more depth. But a cavitation is an infection in the bone marrow, usually where a tooth was taken out, but the socket never healed. So, in many ways, the infection inside a socket from a tooth that was taken out 20, 30 years ago, the infection inside that socket is very similar to the kind of infections that we see in root canal teeth. So here again, and I'm saying it again because it's such an important point, Hal Huggins never had a patient who had cancer who did not also have a root canal or a cavitation. In fact, he actually challenged all of us dentists. He said, "If any of you ever find a patient who has cancer and doesn't have a root canal or a cavitation," he says, "please take the records, please send them to me, and I will give you $1,000. That was the bet. I bet you $1,000 you will never find that patient. And I thought, oh, for sure, I'm going to find somebody because I have a lot of patients. Over 40 years now, have not found a single patient with cancer, not a one, who did not have root canal, dead tooth, or cavitation. I came close once, but missed the mark. And that's an interesting little story. I had a woman who came in with 32 teeth, beautiful smile, gorgeous woman, but she's had breast cancer now twice on the right side. That's important. And I looked at her and I asked her the question immediately. So, where is your root canal tooth? Where's your dead tooth? She goes, oh, I don't have one. She says, I have all 32 teeth. I've never had a root canal. Okay. We continued talking. I finally got around to doing the examination. And while I was examining her teeth, and her teeth were perfect, she had 32 beautiful teeth, I got to tooth number 6, which is the upper right side, upper right canine. And I noticed that the tooth was very dark. It was almost brown. So I asked her, I said, have you noticed how dark this tooth is compared to all your other teeth? Oh, Dr. Grube, I forgot to tell you. Now, in my mind, I've already spent $1,000. I spent that money 6 ways till Sunday, all right? Because I had somebody in my chair who had breast cancer twice and did not have a root canal, didn't have a cavitation, didn't have anything. Okay, wow, I'm going to get $1,000. And suddenly she says, Dr. Grube, I forgot to tell you. I had orthodontic treatment done when I was younger. I had my canine lying sideways up in my jawbone, and they surgically and orthodontically moved my teeth to make room for this tooth, and they brought it down into position. Aha. So that was a dead tooth lying in the bicuspid meridian that is connected to the breast meridian. Right. So, in all fairness, I could not call Dr. Huggins and tell him I found my $1,000 patient. No, I didn't. She had a dead tooth. She was the only one. She was the only one that even came close. Everybody else had a root canal, cavitation, or dead tooth. Now, does that mean that everybody walking around with root canals or cavitations, does that mean that everybody who has them has cancer? No, not yet.
So tell me, what did you end up doing with your root canal teeth?
Oh, it took me 4 months. I'm not proud to say that, but at least I can relate to my patients who say, I don't think I want to have my teeth taken. I go, I understand. It took me 4 months. And I finally said, okay, it's time to tell my husband what's going on. It's time to fess up, and it's time to go to Colorado Springs, have my mercury fillings removed, and have my 5 root canal teeth taken out. What do I have to lose besides a few teeth? I had 3 children, a husband, a dental practice, 2 cats, the whole
9 yards.
the whole 9 yards. I said, you know what, I have to do this. And so I did go to Colorado Springs. I had my mercury fillings removed. My brain fog disappeared immediately, overnight. With just 1 quadrant of mercury removed, my brain fog disappeared. I didn't even know I had brain fog. So sometimes people say to me, well, what can I expect after I get my mercury fillings taken out? I said, I have no idea, because you don't even know what you have until you take the mercury fillings out and it goes away. Then you know what the real you is. You're not even, people who have mercury fillings, I know this sounds like a bizarre statement, but people who have a mouthful of mercury fillings are not even thinking clearly. Their personality is not the real them. Everything they think, everything they do is skewed by the fact that there's mercury in the brain and the brain is not functioning properly.
This goes back this goes back to a story that everyone knows, Alice in Wonderland, and you remember the Mad Hatter in Alice in Wonderland. Why did they call him the Mad Hatter? I think it was a rabbit or something that was called.
No, it was the Mad Hatter. Well, because in the old days, they used mercury to rub into leather to get the leather to soften up so that they could shape it into the shape they wanted for the hat. So the people who used to make hats rubbed that mercury in with their fingers, and they all went mad.
That's right. They got tremors, bizarre behaviors, brain fog, depression. And so eventually somebody figured out the mercury was causing it. I don't know who did, but they stopped using mercury in the felt hats. But this happened in England, and that's where Carol wrote the story about Alice in Wonderland. And so this Mad Hatter, they used to call him, people that made hats would go mad, crazy, and they called them Mad Hatters.
Yeah, but what about all the dentists? What about all the dentists that were using mercury? When I was a dental assistant, now we're really getting historical. I was a dental assistant in 1969. In 1969, people are going to be shocked by this. We did not wear face masks. We did not wear gloves. We squeezed the mercury with the amalgam with a little mortar and pestle, and then squeezed it out onto a cheesecloth. So I was working with mercury in my fingers every day, all day long. And so were the dentists. So most dentists, by the time they reached 50, 55, they already began to have Parkinson-like tremors.
Here's an interesting story. There was a dentist in our center that had come here as one of our guests. We call our patients guests. And I talked about dental amalgams and the dangers of them. This has to be 10 or 15 years ago on my radio program. And he came to me and he said, there's no evidence that mercury causes this, perfectly safe. But his hands were shaking like this.
I feel sorry for the poor fellow. Yeah,
Yeah.
his hands were shaking like crazy. And dentists have the highest suicide rate amongst all the professions, the highest divorce rate amongst all the professions. I mean, we die at the age of 54 on average.
Is that right?
Yeah, that's pretty young. So I don't know why nobody's ever put the pieces of the puzzle together and said, hey, this is what's causing the problem.
Okay,
so I had my mercury fillings removed. My brain fog disappeared overnight. It took another 2 weeks to get around to taking the root canal teeth out, and then my leukemia disappeared. And I've been testing my blood ever since, and I have no signs of leukemia whatsoever.
That's amazing, and that's an amazing fact that you bring about with Hal Huggins saying that he never found anybody with cancer that didn't have a root canal or probably a cavitation as well, or one of the two. So let's talk about in order. Let's talk about oral hygiene, oral health, and then we'll talk about dental health as well. So I want to cover three topics, primarily gingivitis, which is low-grade infection of the gums, periodontitis, which is infections of the bone caused by the gingivitis untreated, and then talk about mercury amalgams. So let's start with gingivitis and gum disease.
Okay. Well, I think the majority of American people have seen the Crest commercials on TV for toothpaste, so they know what gingivitis is. It's inflammation, redness, bleeding of the gums that happens when you don't brush your teeth. But just think about it. Remember, you started the conversation by saying that a farmer would purchase a horse only after he looked in the horse's mouth.
Right.
Well, do horses brush their teeth?
No.
No. Horses do not brush their teeth. So what determines whether or not the horse's gums and teeth are healthy is the diet. And so we have always kind of geared people into believing that brushing your teeth is the most important thing to do if you want to keep from getting cavities. And the truth is, no, it's the diet that is the most important thing.
Absolutely.
You can not brush your teeth, provided that you're not eating the typical American diet.
Which, of course, is high in sugar and simple carbohydrates, the wheat, corn, potatoes, rice, and those products, and candy and cookies and soft drinks and all that sort of thing. All that does is it builds up the plaque, which ultimately leads to gingivitis, and then on, and we'll talk about periodontitis. So when you get gingivitis, by brushing your teeth, can you prevent gingivitis?
Sometimes no. Because if the diet is that bad, you can't stay that long in the bathroom. You won't get anything done.
Weston Price proved this when
That's right.
Dr. Price, who was a dentist, traveled the world back in the 20s and 30s of 1900, 1920s and 1930s, and he went all around the world to indigenous tribes, and those tribes that weren't on the American diet, that had their natural diet, their teeth were perfect. They looked great. And as soon as they adopted the standard American diet, which is a sad diet, they all got their dental hygiene just deteriorated.
Correct. And then their jaws didn't even form properly. If you take a look at the Appalachian children in the Appalachian Mountains, ever since Mountain Dew came out, I mean, it's interesting that they call this drink that is loaded with sugar, they call it Mountain Dew. And it's the mountain people who drink the most of it. I mean, they can brush their teeth 10 times a day. They're still going to have tons of decay. And they have decay worse than in any other part of the country because the tremendous, I mean, there were mothers who were putting Mountain Dew in the baby bottles. You know, if they didn't have Mountain Dew, they would give the kid Coca-Cola. I mean, come on. Really. And the high fructose corn syrup is just simply destroying their metabolism, destroying their whole body's function.
Right.
So the number one indicative decision that somebody has to make is am I going to eat a good diet to try to keep my gums healthy and my teeth strong? That's number one on the list. I was sitting on an airplane and the parents came and sat in front of me and proceeded to give each child a lollipop that was this round so that they would suck on the lollipop through the whole flight and be good little boys and girls.
Right.
I was dying. I was absolutely dying watching this. I thought, why would they ever do that? You know, give their kids a huge lollipop. It's almost as big as their face. Doesn't make sense. So yes, the diet is number one on the list, and number two on the list then is the brushing and flossing. But if the diet's not there, all the brushing and flossing in the world is not going to help.
Right.
It just isn't. The diet has to be a good diet. And when I say good diet, it's just no processed foods. You know, it's fruits, vegetables, meat. Of course, my friends who are the vegetarians would say, no, don't eat meat. I think the decision is still out on that one. I struggle with that one a lot because I can't imagine why God would say to Noah after the flood, you may now eat meat, knowing full well that meat was going to destroy them and have them live shorter lives.
Yeah.
It just doesn't sit well with me that our
Right.
loving Father would say that to Noah and his family. But we didn't eat meat on a regular basis until after the flood. Yes, I understood that there was no vegetation on the earth, and so he's telling them, listen, to survive, you need to eat some meat now. So eat some of the animals that you took on the boat with you. But he didn't say, you know, eat some of the animals just for 6 months, you know, until the plants start to grow again. God didn't say that. He just said, you may eat meat now. So I often struggle. I would love to have a conversation with the Seventh-day Adventists and see what their point of view is on all of that. There are a lot of people who really believe very strongly that we should be on a vegetarian diet all the time. I'm not so sure.
Well, there are others that believe that we ought to be on a carnivore diet all the time, and I've seen many people that have been on a ketogenic diet, which basically eliminates all the simple carbohydrates, which are sugar molecules hooked together, and they turn into sugar in your mouth and all the way in your system and lead to elevated sugar levels, and insulin resistance is overproduced by the pancreas, and it causes a host of health problems. So we found that a ketogenic diet, a good diet in meat and good fats like butter, olive oil, cod liver oil, fish oil, and vegetables and salads are really the best way to eat. And I also recommend intermittent fasting. You eat 1 meal a day. We don't need to eat 3 meals a day. Some people even say, and I think the Diabetic Association and some of these people that promote weight loss say you need to eat multiple snacks all day long.
I know, isn't that funny?
Yeah, it's just so.
It's amazing, and the pyramid. I love the pyramid.
Yeah, so I'll say this, I do intermittent fasting. I weigh 162 to 164 pounds every morning. My playing weight in high school was 168. So, and I've stayed that way for decades. And that's due to intermittent fasting. I eat a meal in the evening, and that's it. And I'm not hungry during the day. I have coffee or, drink coffee and water, and that's about it. And so I think intermittent fasting is something that people need to consider. And then eat healthy when you eat.
Right. And getting back to the gingivitis, if you take a look at your gums, you will be able to tell if the diet that you're on is right for you. Because if the diet that you're on is right for you, your gums will be healthy. You will not have decay. You won't have bleeding when you brush your teeth or when you floss. But if the diet's not right for you and you're missing the boat someplace, then you're going to have problems in your mouth. That's the first place it shows up. It's amazing.
Right. And so then gingivitis, if you've got this chronic gum infection, tell us, what does that lead to?
Okay, well then that bacteria will begin to seep down between the gums and the tooth. And then the bone that's underneath the gums, once the toxins from those bacteria start to seep down all the way and get close to the bone knows that, the body knows that you can't have a bony infection. A bony infection is very serious, very difficult to get rid of. So what happens is the bone begins to recede and shrink down away from the area of infection. But now you've got bone loss, and now we call that now periodontal disease or periodontitis, whenever there is bone loss. Now, bone indirectly is what holds our teeth in our head. And I say indirectly because there are millions of billions of ligaments that attach from the tooth to the bone. So they're really what holds the teeth to the bone. But without the bone there's nothing to hold on to. And so if you lose bone, your teeth start to get loose. And the looser they get, the lower your fulcrum drops. I think most everybody knows what a fulcrum is. If I'm holding this pen like this, and I'm holding it a little higher than 50% of the pen, very difficult for me to push this pen over. But as I lose bone, if suppose my finger is here or the bone, and I start to lose bone and it comes all the way down to here, then my fulcrum has dropped. Well, it's all the way down here now. I only have maybe 1/3, 1/4 of the amount of bone support. Now it's very easy for me to tip my pen over. And so you bite on something hard and all of a sudden you're actually holding the whole tooth in your hand. And so that's what we call serious periodontal disease. And not only do you lose teeth because of bone loss, but as the bone shrinks down, then the roots become exposed, and the roots do not have enamel coating. Our teeth do. The crowns of our teeth have enamel coating, and that protects us somewhat from decay. But the roots do not have enamel coating. They only have a thin layer of something called cementum. Cementum gets scraped off very easily when you go to the dental office for a cleaning, and the nurse, the hygienist says, well, you need to have a deep root planing and curettage. You really should say, no, stop right here. I like my cementum. I want to keep the cementum that I have, because when they do that root planing and curettage, they scrape off all the cementum that was on those roots. And now you're going to get decay on the roots of the teeth. Very, very difficult to fill, very difficult to take care of. And that really is the beginning of the end of the tooth. If the pulp inside the tooth gets infected, it was Weston Price who said that if decay is halfway the distance from the enamel to the pulp, halfway the distance, that pulp is already infected. Well, Lord have mercy, halfway is the point at which dentists begin to see the decay. If it's less than halfway, we say, it's teeny, it's incipient decay, we'll just keep an eye on it. Once it's halfway, yes, you have a true cavity, it's got to get filled. I'm not saying you shouldn't fill it, you should. But you need to know that that pulp is already infected. And it's just a matter of time before you lose that tooth. And so then what does the dentist recommend? Once the pulp is infected and the tooth is starting to hurt, then the dentist says, you know what? You're going to need to have a root canal. And I tell people the word need is a funny word. Some people need to have a Mercedes Benz. They need it. It satisfies their ego. Some people need to have a Volkswagen. Some people need a bicycle. That's all they need. And they can get from their home to work. So need is a subjective term. So when the dentist says you need a root canal, no, you don't. It's if you might want to have a root canal, but if you do, you have to understand there's a price that you're paying for that. You're not only paying for the procedure, that's a price, but you're also paying because you're going to be keeping something that is dead that really should be taken out of the body. You're keeping it inside your head, and that is going to affect the rest of your body.
And that's your tooth. Once they do a root canal, the tooth is dead. And every tooth has over 3 miles of microtubules, little channels within the tooth. 3 miles in one tooth, 3 miles. And so the dentist will say, well, we're going to sterilize the root canal. Once we take the root out, we'll sterilize it and there won't be any problems. But there's no way under heaven that the antibiotic or the medication that they put into your tooth to sterilize the canal can get into all those tubules. It just can't. And within those tubules live anaerobic bacteria, which are also in periodontal diseases. Anaerobic bacteria are bacteria that don't need oxygen to live. And so those bacteria seed the body. They get into the bloodstream, and they travel all over the entire body, and they can cause a host of health problems. We'll talk about this a little bit further, but in cardiovascular disease, studies have shown that when people have a plaque in their heart, and they take that plaque out and they examine it, they find the same anaerobic bacteria that come from periodontal disease, from teeth that have had root canals, from cavitations, and from gum disease. Those same anaerobic bacteria are in your coronary arteries. Coronary artery disease is not caused by cholesterol. It's caused by inflammation in the lining of the coronary artery, the endothelium, and something has to cause the inflammation. And if you find bacteria from the mouth in the plaques of the heart, it doesn't take rocket science to know 1 + 1 is 2. Those bacteria are what cause the inflammation, and the inflammation develops, and the plaque develops, and then it absorbs calcium, trying to keep the artery from rupturing, and you end up getting atherosclerosis, and then those plaques can break off and go downstream in a narrowed coronary artery, plug it up, and you don't get blood supply to that area of the heart where the artery was supplying the blood, and you get a heart attack. So it's not unreasonable to conjecture that the heart attacks in our country could be significantly decreased. Heart disease could be significantly decreased if we weren't seeding our bloodstream with anaerobic bacteria from the teeth.
And could not have said that better.
And let me just ask you, how many times have you gone to a cardiologist and he's asked you or looked and asked, do you have gingivitis, do you have periodontitis, or have you had a root canal, or have you had a cavitation? That should be the questions they ask, because that may be causing the underlying inflammation in your coronary arteries, and they ought to be removed. And what do you do when you remove them? Well, you don't put in what do they do? What do many dentists do? They take the tooth out and then they put in a false tooth.
Now they're putting in implants.
They put implants in, which keeps all the bacteria right up there. It goes right into the bone, and the bacteria breed up there. Isn't that right?
Yeah, they're doing them the same day they take the tooth out. They take the infected root canal or infected abscess tooth out. They shove some graft material. Sometimes that graft material comes from cadaver bone. Sometimes it's artificial bone, sometimes it's animal bone. They shove that inside the socket and then they put an implant in there. And that's a freshly infected socket. And they're sticking an implant in there, and you're supposed to go ahead and heal and have a wonderful life after that. It just doesn't happen.
Well, that's right. And so this is, and besides, these bacteria cause bacteremia in the blood, and they go to any organ. They can affect the brain. They can affect not only the heart, but the brain, the liver, the kidneys, your joints, and it causes systemic and chronic inflammation. And that's the cause of chronic disease. What happens is you have systemic inflammation that causes your health problems. And it may all be coming, I'm not saying it all comes from the teeth, but there's a likelihood that a great majority of this comes from the teeth. It can also come from leaky bowel syndrome too. But if you've got a root canal or you've got a cavitation, we'll talk about that in a minute, or gingivitis or periodontitis, you have got a problem with seeding your body with dangerous anaerobic bacteria, which don't belong in your body. They don't belong in your teeth, but you've got it. And unless you address that underlying problem, you'll never get rid of your chronic disease. That's why I'm so adamant about teaching you about dental health and oral hygiene, and that's why I brought Blanche Grube on the program today. So today we've had the great experience of Dr. Blanche Grube as a biological dentist explain to us the dangers of gingivitis, periodontitis, and root canals, and some about mercury amalgams. And we're going to have another broadcast with her, and we're going to talk about cavitations, and we'll talk some more about mercury amalgams, because there's a lot more to say about mercury amalgams from a medical point of view, that I want you all to understand the dangers of the mercury and the dangers, of course, of the root canals and the danger of cavitations. So, Blanche, thank you for joining us today. Thank you for your wonderful work and for being able to explain in a very simple way the importance of oral hygiene and oral health. If you would like to have more information, Blanche, where can they go to find your website?
The best thing to do is to get the book, Chew on This, But Don't Swallow. You get that through either Amazon or BookBaby.
And it's called Chew on This, But Don't Swallow.
Yeah, it has an apple on it, but I have nothing to do with Apple Corporation. Just an apple bit. Chew on this, but don't swallow.
Right.
And more than half of the book is research, so that you know that every sentence that is said in this book is supported by peer-reviewed scientific research. Everything, every sentence.
Well, I would encourage you all to get a copy of Dr. Blanche Grube, Grube's book, Chew But Don't Swallow, and that will help inform you. And I encourage you, you can go online, go on DuckDuckGo, and just start on the internet asking questions about root canals in their danger, gingivitis, periodontitis in their danger, and the relationship between heart disease and other chronic diseases in the body. A ton of work has been done on this, but it goes uninformed to most physicians. They don't read this. They don't have an interest in it, and most dentists don't want to know about it, and we'll talk about that when we have our next segment. Thank you so much again, Blanche, for joining us, and thank each one of you for being here today.
Thank you very much.
Pharmacists are considered the most accessible healthcare professionals, and yet at the same time, we are generally the most underutilized. Pharmacists are medication experts, which means that we can best advise you on the safe and appropriate use of your medications, when to take them and how to take them. We're experts in pharmacology, which means that we receive extensive training to understand the science behind how medications work within the body. We screen for any interactions which may occur between the medications you're taking, and we have an in-depth understanding of how these medications affect each system of the body. Your body is unique, which means that the type and dose of medication you take should also be unique. We want you to know that at Physician's Preference Pharmacy, we are always available to you, and we welcome your questions.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.